Hey guys, so I'm going to continue on to add to my topic from speech 1 about why your oral hygiene is so important for not just the look of your teeth and for the way your breath smells, but also for the underlying issues that can truly be caused if you have bad oral health. Oral systemic health demonstrates the connection between oral hygiene and your overall body health. Many studies have shown that poor dental and oral hygiene have led to serious health concerns because of bacteria that starts in your mouth and enters your bloodstream. So many diseases can be caused by poor oral health, but for the sake of time, I'm just going to inform y'all on about 5 or 6 of them. The first is Alzheimer's disease. Alzheimer's is a brain disorder that causes problems with thinking, memory, and your behavior. When bacterium generates inside your mouth, it can allow it to travel to the brain and potentially kill some brain cells. Specifically, oral spirochetes are pathogenic bacteria that can kill brain cells and cause that memory loss. It's been seen in research that spirochetes have a higher presence in the brains of Alzheimer's patients, so it seems to be a cause of Alzheimer's. Oral health concerning Alzheimer's disease has allowed researchers along the way to understand more about this disease. Respiratory diseases such as pneumonia and bronchitis can also develop because of your oral health. Pneumonia is an infection in the air sacs of your lungs. Bronchitis is an inflammation in the airways, your trachea, and your bronchi that lead to your lungs and cause you to cough heavily. If you inhale bacteria in the air, it can travel down into your lungs or travel via bloodstream to restrict air to the lungs. It is very important to go to the dentist frequently to reduce the progression of infection from your mouth to lungs. In my opinion, the most important disease to stray away from is periodontal disease because of its ability to cause problems in other areas of the body and not just your mouth. So periodontal disease, which is also called gum disease, comes from inflammation and infections inside the mouth. Periodontal disease decreases the ability to fight off infections because there's so much bacteria in there. One condition that it can cause is erectile dysfunction. Bacteria from periodontal disease can flow into the bloodstream and block blood flow to the genitals. According to studies, men with periodontal disease are 3 times more likely to get erectile dysfunction. Periodontal disease can also cause osteoporosis. Osteoporosis is a skeletal disorder that weakens your bones and can cause extreme bone and tooth loss. If you have a history with periodontal disease, you're highly likely to develop osteoporosis. Although osteoporosis can also be a cause of periodontal disease, the decrease in bone density that osteoporosis causes can affect the overall response of the bacterial plaque inside your gums and jaw that causes periodontal disease. The last and very important reason for you to take care of your mouth, especially for women, is it could affect pregnancy very negatively with premature and low birth rates. So women, you just need to make sure that you're taking care of your mouth. Research has shown that pregnant women with gum disease may raise the levels of the chemicals that start labor. Women with periodontitis are 6 times more likely to give birth to premature babies, with 1 in 4 chance that pregnant women with gum disease will give birth before 35 weeks. Bacteria in the mouth, such as Fusobacterium nucleatum, has been found inside the placenta, your amniotic fluid, and the membranes of preterm babies, which leads us to believe that poor oral health leads to complications in pregnancy. All of these complications and diseases that affect our body can just be prevented from keeping our mouths healthy. It is very necessary to go to the dentist every few months to block gum disease from happening because it can cause you so much more harm in the body than just inside our mouth. So I encourage you to make sure that you're going to the dentist to take care of your mouth and your teeth so that you don't have all these underlying issues. So I hope that you're taking care of your mouth.